Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss what to eat after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. When it comes to what to eat or what you should eat after surgery, we first want to think about what are our goals. So we have a handful of main goals that we want to achieve after surgery. One of them is building back strength. After surgery, your muscles are weak, they're atrophied, they don't have as much contraction and as much force, and so we want to have food and nutrients that are going to help build back that strength and build back those muscles. Two, we want to improve and maximize the healing of your body, the healing of your knee and the structures around the knee that were compromised because of the surgery. Three, we want to reduce your risk of having an infection. An infection is one of the main risk factors of a knee replacement, and so if we can have adequate nutrients to hopefully reduce that risk as much as we can. And then another one that you might not think about is just maintaining healthy bowel movements and healthy absorption and digestion and everything else. So reducing your risk of constipation, reducing the risk of nausea, both because of a lot of different things, the anesthetic from surgery, from any pain medicine you might be taking, things like that. These are things that we want to be aware of. So something to keep in mind is post-surgical malnutrition is extremely prevalent after any type of orthopedic surgery, after knee replacement surgery is included in that. And this tends to be more prevalent in the older population, as you might expect, but anyone can have this malnutrition, and part of it is just your appetite tends to be suppressed. You tend not to be quite as hungry. This may be, again, because of medicine, anesthetic, pain, just being kind of drowsy and feeling tired and fatigued after surgery. And so you're not getting the nutrients that you need. And really, your body needs more nutrients than it probably did prior to surgery because it's working overtime. It's trying to heal and recover, build back those muscles and everything we just talked about. So you probably need a little bit more calories than you did prior to surgery. Of course, we want these to be good and beneficial calories and not just empty calories that aren't going to be helpful. So first thing, definitely, probably one of the most important, is getting adequate protein. And this can be from animal-based protein or it can be non-animal sources such as beans, nuts, seeds, things like that. When you are getting it from animal sources, it can be really helpful to get lean protein, chicken, fish, things of that nature, just to try to limit the amount of fat and the saturated fat that you're getting in your body that can be negative if you get too much of it. But trying to get that protein, again, trying to build up that muscle, it's going to help your immune system, it's going to help you heal and recover. We also want to think about our fluids. We want to be adequately hydrated. And this is going to help with, again, making sure you're just having good digestion, good bowel movements. It's going to help with your energy levels, and it's going to just help overall with the healing and recovery process. Now again, thinking about your, reducing risk of constipation, making sure digestion is going okay, we want to try to eat some foods that are rich in fiber. So fruits, vegetables, things of that nature, whole grains, trying to get good fiber in our diet to help keep ourselves regular. A couple other things. Vitamin A. Vitamin A can be important for healing, for your immune health. So that can be through things like fish, also things with beta carotene, so carrots, sweet potatoes, red peppers, great sources. Zinc is really helpful in healing and recovery, so shellfish, nuts, dairy, and also from lean meats you can get your adequate amounts of zinc. Vitamin C, we of course know vitamin C important for immune system and immune health. So that's your citrus fruits, oranges, limes, things like that, kiwis, and also from vegetables you can get vitamin C as well. And just think about your overall diet. Think about what would be included in a normal, healthy diet. So we want to think about trying to get, as much plant-based nutrients as we can. And that's because that's going to be anti-inflammatory. It's going to help kind of your immune health. It's going to help your healing. And it's just going to help kind of keep any inflammation and swelling and things, keep that under control as much as we can. Swelling and inflammation is a normal part of the healing process after any type of trauma to your body, but we just want to make sure that that doesn't, run rampant and run to an excess. So trying to have plant-based food, lots of fruits and vegetables, can be really beneficial and really helpful. We also want to just stay away from, things that we know that are going to be unhealthy, things that we know are going to, promote inflammation in your body, things that are high in, highly processed foods. We want to try to limit and stay away from as much as we can. We want to try to stay away from things high in sugar, high in salts. These are just going to promote inflammation in your body. And you really want to have, in most instances, you probably don't want to drink any alcohol, especially early on if you're taking any pain medicines or other medication, but really just trying to limit alcohol throughout the recovery process, as this, is going to disrupt your sleep quality, can lead to some fatigue, things like that. So really try to limit that. And then the last point I want to bring up is sometimes if you still aren't feeling like you're getting adequate nutrition, sometimes a supplemental nutrients may be helpful. So that may, in most instances, that's kind of like a whey protein or some type of protein supplement drink, for example, that is just going to help increase the amount of protein that you're getting into your body to help improve and hopefully speed up that building of strength, building of function and mobility after surgery. So I hope you found this video helpful. If you have other tips or if you have any questions, please be sure to leave your comments below. Again, please be sure to hit that subscribe button. Thank you all very much for watching.